Good morning, ladies and gentlemen. At the outset, I would like to thank the organizers of the 7th Business World Healthcare Excellence Summit and Awards for giving me this honor of delivering the keynote address for such a prestigious event. Ladies and gentlemen, I am a simple clinical specialist and ENT surgeon by profession and now a hospital administrator managing the prestigious Sir Ganga Hospital. I am not going to give a PowerPoint presentation of statistics of the health spending, infrastructure addition, and government initiatives to put India on the road to New India as far as healthcare is concerned. I am going to give you an overall scenario of what we were, what we are, and what we aim. India is known for its traditional medicine system. Ayurveda, Siddha, and Unani medical systems find mentions even in the ancient Vedas and other scriptures. The Ayurvedic concept appeared and developed between 2500 and 500 BC in India. Sushruta is one of the earliest known plastic surgeon of India with his own devised instruments, and you will be surprised when we study those instruments. They are comparable to what plastic surgeons use today, even today. However, unfortunately, for centuries, our system of medicine was non-recognizable, mainly because of no standardization and no evidence-based studies. However, ladies and gentlemen, today our generation stands on the cusp of healthcare revolution on various fronts. I would like now to dwell on the existing setup, the shortcomings and challenges. Culture, values and institutional influence, health technology assessments, and economic evaluations in countries such as the United Kingdom and parts of Europe by affecting the organization of the healthcare system. Nevertheless, no such exists for low and middle income countries which are learning from these nations. India is an example of a country in which HTA is in the initial stages and its struggles might differ from those of other nations because of its cultural and political framework. In a country with dire healthcare needs and divisive inequality, delivering affordable and equitable healthcare is both a challenge and an opportunity. Poor funding and health insurance coverage characterize the current landscape of medical practice in India. The government has already dedicated on a global level to provide universal health coverage to its citizens. Recently, in 2018, it announced the Ayushman Bharat scheme to foster the implementation of universal health coverage. The establishment of a health technology assessment agency in India is crucial to achieve the goal of universal health coverage and to rationalize healthcare spending within constrained budgets or limited resources. In India, the political ideologies greatly influence health policies by affecting decisions related to technology, allocation of resources, and extent of healthcare accessibility to the citizens. Unfortunately, these political ideologies are also tied to caste and religion-based needs. As India already faces the challenge of combating corruption and lack of regulation at all levels of governance, it is important to produce evidence-based research and do it transparently. The second issue is that of regulatory frameworks, which is affected by the unregulated, uncoordinated, and diverse healthcare market in India. There is a wide availability of low-cost alternative treatments and locally manufactured drugs and devices alongside imported treatments. Nevertheless, there is minimal clinical and economic evidence available on these generic medicines and alternative treatments. Thirdly, like in any other low and middle income country, India faces a lack of data on cost and quality of life related to health. The main reason is that healthcare data are often not recorded and rarely digitalized. One of the solutions to digitalize the recordings and make a collective data repository. To reduce the variability of clinical practice, poor diagnosis, irrational use of medicines, and understanding treatments, clear standardized guidelines are also important. Although there is a need to use the existing resources in a manner that maximizes health per every rupee spent, evidence-based decisions making in a pluralistic society such as India is a challenge and requires a structure that incorporates and embraces diversity. Public health care is free to every Indian resident. The Indian public health sector encompasses 18% of total outpatient care and 44% of total inpatient care. However, middle and upper class individuals living in India tend to use private healthcare rather than the public healthcare. Additionally, women and elderly are also compelled to use public services. The public healthcare system was originally developed in order to provide a means to healthcare access regardless of socioeconomic status or caste. However, reliance on public and private healthcare sectors varies significantly between states. Since health is a state subject, this is one of the dichotomy in our healthcare delivery system. The national health policy of the government was endorsed by the Parliament of India in 1983 and updated in 2002 and then again in 2017. The recent four main updates in 2017 mentions the need to focus on growing burden of non-communicable diseases, the emergence of robust healthcare industry, growing incidence of unsustainable expenditure due to healthcare costs, the rising economic growth enabling enhanced financial capacity. Furthermore, in the long term, the policy aims to set up India's goal to reform the current system to achieve universal healthcare. Now coming to financing, which as you all know, India ranks amongst one of the lowest in the world in terms of public expenditure on healthcare due to significant limitations in its workforce infrastructure, along with deficiencies in quality and availability of healthcare services. With a shortage of doctors and healthcare providers who are usually concentrated in urban environments, along with the already low government expenditure on health in India, a large percentage of the population is left unreserved by the Indian health system, which relies on out-of-pocket payment from patients to fund care. These payments hinder a lot of patients from being able to receive proper healthcare services. Despite being one of the most populous country, India has the largest private healthcare in the world. Out-of-pocket private payment makes up to 48% of the total expenditure on healthcare, while government and health insurance funds accounted for 62%. This is in stark contrast to other countries of the world, and according to the WHO in 2007, India ranked 184th out of 191 countries in the amount of public expenditure spent on healthcare out of total GDP. Now, this is a fact which is known to all of us, our policymakers. However, there are constraints, there are priorities, but this is one of the important aspect which has to be looked if we aim to achieve a universal health care for all Indians. Now, it's not that the government has not started a lot of programs. There is a National Health Protection Scheme. The ESI is looking after the health in the organized sector, and the government has a 12th plan to expand the National Rural Health Mission, the Pradhan Mantri Jan Arogya Yojana. And finally, the public and private partnership. This is one area where a lot of emphasis has to be laid, because I feel this is what is going to be the game changer for a country like India. Finally, the National Rural Telemedicine Network connects many healthcare institutions together so doctors and physicians can provide their inputs into diagnosis and consultation. This reduces the non-medical cost of transportation, as patients do not have to travel to get specific doctors or specialists' opinion. However, this is again in an infancy stage and needs a lot of input technologically as well as financially for it to be meaningful. Now, all is not lost. India has emerged as a leader in global pharmaceutical industry, and the time has come for it to leverage its talent pool and cost advantages across the wider healthcare spectrum. What made all of us proud was the sheer resilience and commitment of our people, not just at the leadership level, but at every plant and operative level in the field in the grim days of COVID. In the worst of times, we had to remain open in terms of manufacturing to make products available, not only for India but around the world. India owns about 40% of world production, so to have facilities running and be able to supply products globally showed people's incredible commitment and resilience. Another issue in those 2 years was how we used new communication methods, infrastructure capabilities, and digitalization to be able to work more seamlessly. There was a big jump in the adoption of these capabilities, and this has become a way of life, allowing us to operate more effectively. Medical science, ladies and gentlemen, is moving towards a more biologically oriented model. There are more drugs coming out into the market, such as gene therapy, cell therapy, and CAR T therapy, that target specific or very rare diseases. These newer sciences are available globally, but at their price point, they have a limited market. Given that challenges what happens with the rest of this world, this is where a great opportunity for Indian pharma companies. The other area is medical devices. Healthcare is growing globally and countries need medical equipment and devices. Currently, most of the equipments are produced in the West. They are expensive, so many countries cannot afford it. India has done very well with pharma production and the time has come for it to do similarly with medical devices. This is another big opportunity for the country's healthcare sector. India has always done research, but it is incremental. To get from incremental to fundamental research, we need a much larger research canvas. This has started to happen, and this is the way forwards. With regards to artificial intelligence, it is too early for us to understand the concept and the variants of what generative AI can do, but it is something which we must learn because research in the future may happen in this way. So, ladies and gentlemen, finally, in my opinion, Indian healthcare industry is entering its golden period, and that is because of government awakening for the concept of health for all, private penetration, pharma revolution, financing, and above all, the confidence of this generation is going to lead this story to a fairy tale ending. Thank you very much.